I'm about to show you why seemingly healthy adults over 60 suffer heart attacks despite normal checkups, and the overlooked numbers that reveal your true risk. Standard cholesterol panels often miss nearly 50% of people at risk for a cardiac event, leaving millions of seniors with a false sense of security until a sudden emergency occurs. I remember a patient named Robert, 68, who walked 5 miles daily and had perfect blood pressure readings, yet he collapsed during a routine hike due to a blockage his doctor's standard tests never caught. Symptoms like subtle fatigue or shortness of breath were dismissed as just aging, but in reality, they were warning signs of arterial damage that could have been detected with the right advanced markers. Before we begin, a critical disclaimer. The information I'm sharing today is strictly for educational purposes and should not be considered medical advice. I am not your personal physician and cannot provide individualized medical guidance through this video. Never stop, start, or change any heart medication without first consulting with your doctor. 1. The particle number misconception. Most seniors rely heavily on their standard LDL cholesterol number, the bad cholesterol, to gauge their heart health. However, relying solely on LDL concentration can be dangerously misleading because it measures the total weight of cholesterol in your blood, not the number of particles carrying it. Think of cholesterol like passengers in cars on a highway. Standard tests count the total weight of the passengers, but what clogs the road and causes accidents is the number of cars or particles on the road. You can have a normal LDL weight, but a very high number of small, dense LDL particles that easily penetrate and inflame your artery walls. This discordance is why many people with low cholesterol still have heart attacks, as the small particles fly under the radar of standard lipid panels. I recall a patient named James, 72, who was told his cholesterol was perfect at 100 mg/dl, yet he had significant plaque buildup in his coronary arteries. James ate a low-fat diet but consumed high amounts of refined carbohydrates, which drove up his particle number even though his total cholesterol weight remained low. We switched his focus to reducing processed carbs and increasing healthy fats, which lowered his particle count and stabilized his plaque progression within 6 months. The crucial action here is to ask your doctor for an ApoB test or an LDLP particle number test, which gives a much more accurate picture of your actual risk than standard LDL-C. ApoB counts every single atherogenic particle in your blood, including LDL, VLDL, and IDL, providing a comprehensive count of the cars clogging your arterial highway. Research consistently shows that when LDL-C and ApoB disagree, the risk of heart disease follows the ApoB number, not the standard LDL number. This simple blood test is widely available but rarely ordered as a standard screening, often requiring you to specifically request it from your cardiologist or primary care physician. Understanding this number shifts the focus from just lowering a generic number to actually reducing the burden of particles that physically crash into your artery walls. If your ApoB is high, even with normal LDL, you are at an elevated risk for plaque accumulation and should discuss targeted therapies or lifestyle changes with your provider. Focusing on fiber intake and reducing added sugars are two immediate dietary levers that help lower ApoB by clearing particles from the bloodstream more efficiently. 2. The widening gap, pulse pressure. Blood pressure is typically given as two numbers, systolic over diastolic, and patients usually focus only on the top number or the bottom number individually. However, the gap between these two numbers, known as pulse pressure, is a powerful independent predictor of heart attacks in seniors, often more significant than systolic pressure alone. A widening gap indicates that your arteries are stiffening and losing their natural elasticity, forcing your heart to work much harder to pump blood through a rigid system. Ideally, your pulse pressure should be around 40 mmHg, for example 120/80, but a gap consistently over 60 mmHg suggests significant arterial hardening. This stiffness increases the mechanical stress on your delicate blood vessels, particularly in the brain and kidneys, and directly damages the heart muscle over time. I remember seeing a patient named Margaret, 66, whose blood pressure was 150/70, giving her a dangerous pulse pressure of 80, yet her doctor only focused on the 150. She experienced frequent dizziness upon standing and mild headaches, symptoms of the extreme pressure wave hammering her system with every beat. We focused on magnesium-rich foods and specific isometric exercises to improve her arterial flexibility, gradually bringing her gap down to a safer 55 mmHg. Her previous doctor had increased her beta blockers, which lowered her heart rate but didn't address the underlying stiffness causing the wide gap. To track this, you must calculate your pulse pressure by simply subtracting the bottom number from the top number after every reading. Do not ignore a low diastolic number, the bottom number, if the top number remains high. This isolated systolic hypertension is the classic sign of stiff arteries in seniors. A very low diastolic pressure can actually be dangerous because it means less blood is filling the coronary arteries between heartbeats. Improving arterial flexibility involves increasing your intake of dietary nitrates found in beets and leafy greens, which help dilate blood vessels naturally. Regular aerobic exercise, like brisk walking, also stimulates the production of nitric oxide, the gas that keeps your arteries relaxed and pliable. Monitor this gap weekly and bring a log to your doctor, specifically pointing out the wide difference if it exists, as it requires a different management strategy than standard high blood pressure. 3. The post-meal glucose spike. Many seniors believe they are safe from heart disease if they have not been diagnosed with diabetes, ignoring the damage caused by insulin resistance. However, massive blood sugar spikes after meals can damage the endothelial lining of your blood vessels even if your fasting glucose and A1C are in the normal range. These sharp spikes create a burst of oxidative stress and inflammation that physically scuffs the inside of your arteries, creating spots where plaque can easily stick. You might feel a sudden wave of fatigue or food coma after a carb-heavy meal, which is often a direct symptom of this rapid glucose rise and subsequent crash. This metabolic roller coaster forces your pancreas to pump out massive amounts of insulin, a hormone that, in excess, promotes fat storage and arterial inflammation. I treated a patient named David, 70, who had a fasting glucose of 95 but would spike to 180 mg/dl after his morning bowl of oatmeal and fruit. David experienced mid-morning brain fog and energy crashes, dismissing them as just needing more coffee, unaware his arteries were being inflamed daily. By simply adding a 10-minute walk immediately after his meals, he blunted these spikes significantly, keeping his post-meal glucose under 140 mg/dl. He also started eating his protein and vegetables before his carbohydrates, a strategy known as food sequencing, which further slowed sugar absorption. The immediate lever here is movement. Using your muscles within 30 minutes of eating draws glucose directly from the blood to be burned for energy. This prevents the sugar from lingering in your bloodstream and causing the oxidative damage that precedes plaque formation. You don't need intense exercise. A simple, brisk walk around the block or tidying up the house is sufficient to activate this glucose clearing mechanism. Reducing the glycemic variability, the highs and lows of your blood sugar, is as important for heart health as lowering your average blood sugar. Consider using a continuous glucose monitor, CGM, for 2 weeks, even if you aren't diabetic, to see exactly how different foods affect your body. Many seniors are shocked to find that healthy foods like whole wheat bread or tropical fruits cause spikes similar to candy. Understanding your personal tolerance allows you to modify portion sizes or food combinations to protect your blood vessels from this invisible daily assault. Managing these spikes is a proactive way to preserve your endothelial function and prevent the microscopic injuries that eventually become heart attacks. 4. Hidden calcification and vitamin K2. A surprising number of seniors diligently take calcium supplements to protect their bones, unaware that this excess calcium often ends up hardening their arteries instead of strengthening their skeleton. This phenomenon, known as the calcium paradox, explains why many older adults suffer from osteoporosis and atherosclerosis simultaneously. Their bones are starving for minerals while their blood vessels are turning into stone. The missing link in this process is usually vitamin K2, a nutrient that acts like a traffic cop for calcium, directing it into the bone matrix where it belongs and keeping it out of soft tissues like the heart. Without adequate vitamin K2, calcium floats freely in the bloodstream and deposits itself into the arterial walls, creating rigid plaques that are prone to cracking and causing clots. I recall a patient named Eleanor, 74, who had been taking high-dose calcium carbonate for a decade to prevent hip fractures, yet her coronary calcium scan revealed a dangerously high score of over 400. Eleanor was confused because her bone density scans showed little improvement, meaning the calcium she was swallowing was not effectively reaching her skeletal system. We immediately stopped the isolated calcium supplementation and introduced a protocol involving vitamin K2, specifically the MK7 form, alongside vitamin D3 and magnesium to correct the imbalance. Vitamin D3 helps your body absorb calcium from the gut, but it relies entirely on vitamin K2 to activate the proteins that actually move that calcium into the bone. Magnesium is the third critical pillar, as it is required to convert vitamin D into its active form. Without it, the entire transport system for minerals stalls. This trio works synergistically to decalcify soft tissues over time, potentially stabilizing existing arterial plaques and preventing new deposits from forming. Most seniors are deficient in K2 because it is found primarily in fermented foods like natto, hard cheeses, and certain animal fats, which are often missing from modern low-fat diets. Eleanor's follow-up scan 2 years later showed no progression in her calcium score, a massive victory indicating that the active calcification process had been halted. The action step here is to review your supplement routine. If you are taking calcium or vitamin D, ensure you are pairing it with at least 100 to 180 micrograms of vitamin K2, MK7 daily. You should also look for dietary sources, such as Gouda or brie cheese, egg yolks from pasture-raised chickens, or goose liver, which naturally contain this protective nutrient. Be cautious if you are on blood thinners like warfarin, as vitamin K can interfere with these medications. However, newer anticoagulants often do not have this restriction. Consult your doctor specifically about vascular calcification and ask if a coronary artery calcium (CAC) scan is appropriate for you to establish a baseline. This simple, non-invasive scan takes less than 10 minutes and provides a definitive answer about whether your arteries are actively calcifying, regardless of your cholesterol levels. Addressing this mineral mismanagement is one of the most effective ways to ensure that your efforts to build strong bones don't accidentally compromise your heart health. 5. The silent sleep stressor. Many seniors assume that if they sleep through the night without waking up, their sleep quality is adequate, ignoring the subtle signs of oxygen deprivation that strain the heart. Mild sleep apnea or chronic mouth breathing can cause your blood oxygen levels to drop repeatedly during the night, triggering a panic response in your nervous system. Even if you don't snore loudly or gasp for air, these micro drops in oxygen force your heart to beat faster and your blood pressure to spike while you are unconscious. This nocturnal hypertension prevents your cardiovascular system from getting the restorative dip in blood pressure it needs to recover from the day's stress. I treated a patient named Arthur, 69, who claimed he slept like a log for 8 hours every night, but woke up with a dry mouth and a slight headache. Arthur was fit and didn't fit the typical profile of a sleep apnea patient. Yet a home sleep study revealed his oxygen saturation dropped to 88% dozens of times an hour. This intermittent hypoxia was the hidden driver behind his resistant high blood pressure, which refused to normalize despite 3 different medications. The primary issue was that Arthur breathed through his mouth while sleeping, causing his tongue to fall back and partially obstruct his airway. We implemented a simple strategy of mouth taping, using a small piece of porous surgical tape to gently keep the lips closed, forcing him to breathe through his nose. Nasal breathing increases nitric oxide production, a gas that dilates blood vessels and improves oxygen uptake efficiency in the lungs by nearly 20%. Within weeks of switching to nasal breathing and using a positional pillow to stay on his side, Arthur's morning blood pressure readings dropped by 15 points. The long-term lever here is ensuring airway patency. You must prioritize nasal breathing day and night to keep your autonomic nervous system in a calm, parasympathetic state. If you suspect this is an issue, you can try a simple screening tool like a pulse oximeter that records overnight data to see if your oxygen levels dip below 90%. Sleeping on your back is often the worst position for airway health as gravity pulls the soft tissues of the throat downward. Side sleeping is mechanically superior. Elevating the head of your bed by just a few inches can also use gravity to keep the airway open without the need for expensive machines or uncomfortable masks. Addressing these silent sleep stressors reduces the adrenaline surges that thicken the heart muscle and stiffen arterial walls over decades. It is a passive therapy that requires no effort once you are asleep, but pays massive dividends for your cardiovascular longevity. Do not ignore morning grogginess, dry mouth, or the need to urinate frequently at night, as these are often the only clues that your heart is running a marathon while you sleep. 6. Gum health and systemic inflammation. It is easy to compartmentalize oral health as separate from heart health, but the mouth is actually a direct portal to your bloodstream and a primary source of systemic inflammation. Specific bacteria found in gum disease, such as Porphyromonas gingivalis, have been found embedded directly inside the atherosclerotic plaques of heart attack victims. When your gums bleed, even slightly during brushing, these bacteria enter your circulation and travel to the heart, where they trigger an immune response that destabilizes existing plaque. This inflammation can turn a stable, calcified plaque into a hot, vulnerable lesion that is likely to rupture and cause a sudden blockage. I remember a patient named Martha, 71, who had elevated C-reactive protein, CRP levels, a marker of total body inflammation that we couldn't lower with diet or statins alone. Martha admitted she hadn't seen a dentist in 3 years and often noticed pink in the sink when she brushed, a clear sign of active periodontal disease. Her gums were essentially a large open wound roughly the size of a human palm if flattened out, constantly leaking bacterial toxins into her blood. We coordinated her care with a periodontist who performed a deep cleaning to remove the bacterial reservoirs deep in her gum pockets. Following her dental treatment and the adoption of a daily water flossing routine, her CRP levels plummeted to normal range for the first time in 5 years. The specific action you must take is to go beyond simple brushing. You need to disrupt the bacterial colonies that live between the teeth and under the gum line. Water flossing is often more effective than string floss for seniors because it flushes out the pockets where anaerobic bacteria thrive and is easier on arthritic hands. You should view your dental hygiene routine not just as a way to save your teeth, but as a critical daily defense for your endothelial lining. If you have receded gums or loose teeth, this is a major red flag that your inflammatory load is high and your heart is bearing the brunt of that burden. Recent studies suggest that treating moderate to severe gum disease can improve endothelial function as effectively as some blood pressure medications. Make it a habit to schedule professional cleanings at least 3 times a year, rather than the standard 2, if you have a history of heart disease or high inflammation. Using a mouthwash containing chlorhexidine or essential oils can also help reduce the bacterial load, but mechanical cleaning is always the most important step. Never dismiss bleeding gums as normal aging. It is a sign of a breached barrier that allows pathogens to assault your cardiovascular system. By sealing this barrier, you remove a constant source of low-grade infection that keeps your immune system on high alert and your arteries inflamed. 7. Visceral fat in skinny seniors. There is a dangerous misconception that being thin protects you from heart disease, leading many slender seniors to ignore their metabolic health until it is too late. This condition, often called TOFI, thin outside, fat inside, occurs when dangerous visceral fat accumulates around the internal organs despite a normal body weight. Unlike subcutaneous fat, which sits harmlessly under the skin, visceral fat is metabolically active tissue that pumps inflammatory cytokines directly into the liver and heart. You can have a normal body mass index, BMI, and look frail in your arms and legs, yet carry 3 or 4 pounds of toxic fat packed tightly around your pancreas and kidneys. I recall a patient named Thomas, 75, who was proud of his 30-inch waist and slender build, attributing his health to a diet of toast, tea, and crackers. Despite his small size, Thomas had high triglycerides and low HDL, the classic lipid profile of someone with significant insulin resistance and visceral adiposity. Thomas had very little muscle mass, a condition known as sarcopenia, which meant his body had nowhere to store glucose except as visceral fat. The lack of muscle acted as a metabolic bottleneck, forcing even small amounts of sugar and starch to be converted into organ fat that poisoned his system. We shifted his focus from eating light to eating strong, prioritizing high-quality protein at every meal to stimulate muscle retention. He began a simple routine of bodyweight squats and resistance band exercises twice a week to send a signal to his body to build lean tissue. The most effective lever for reducing visceral fat is not cardio, but resistance training, which improves insulin sensitivity and burns fat from the inside out. Seniors often avoid weights for fear of injury, but muscle is the largest endocrine organ in the body and the primary disposal site for blood sugar. You should aim to consume at least 30 grams of protein at breakfast, such as from eggs or Greek yogurt, to anchor your metabolism for the day. Avoid the tea and toast phenotype. This low-protein, high-carb dietary pattern is the fastest way to develop visceral fat while losing protective muscle. Measuring your waist-to-height ratio is a better predictor of this risk than BMI. Your waist circumference should be less than half your height. If you have a protruding, hard belly, even if you are thin everywhere else, this is a sign of visceral fat pushing the abdominal wall outward. Reversing this condition requires a deliberate effort to feed your muscles and starve the visceral fat through lower carbohydrate intake and higher protein consumption. By building a metabolic sink in the form of muscle, you protect your organs from the fatty infiltration that drives heart failure and metabolic syndrome. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple health tips.